ingrown nail is a condition in which the side or corner of a nail grows into flesh and causes redness, swelling, pain, and at times infection. It usually affects the big toe, and often you can take care of an ingrown toenail yourself, but at times the pain can be severe or spreading. So in this case, you have to see a doctor who would take steps to relieve your discomfort and help you to avoid the complications of an ingrown toenail. The doctor will use local anesthetic to avoid pain and will also use a cauterizing agent to avoid excessive bleeding. They will have to remove all the nail that's growing underneath the skin and also will remove it down to its root. In this particular case, all these parts were growing underneath the skin and they were causing discomfort like pain and swelling. How do you identify that you've got an ingrown toenail? The symptoms include pain and tenderness in one side or both sides of your toe. At times you can see just redness around the toenail. At times you can see swelling around the toenail. At times you can even see pus as evidence of infection around the toenail. All these point to the fact that someone has got an ingrown toenail. If you see these signs and symptoms, please report to a doctor. If your country does not have any podiatrist, you can go even to a GP. Let's take a quick look at the risk factors of ingrown toenails. These include wearing shoes that crowd your toenails, cutting your toenails too short or not straight, that is following the curvature of your nail borders. It can also include injury to the toenails in any form, including trauma. It can also include having unusually curved toenails. All these are the risk factors of an ingrown toenail. Now, what are the complications of an ingrown toenail? So if you leave your ingrown toenail untreated or unattended to, the most feared complication would be infection of the underlying bone, which is the infection that extends from the area where there is a nail underneath the skin, extending to the underlying bone, causing severe bone infection, which can spread. Prevention includes reducing the risk factors. So it includes trimming your nails straight, not following the curvatures of the edges, keeping moderate length of your toenails, wearing shoes that fit properly, and wearing protective footwear. Always check your feet, and if you are diabetic, you need to make sure that you get screened yearly by a podiatrist, because you'll be at a greater risk of losing even the whole toe.